pick a spot.
Any of the X's?
Sure. I mean, let's do that. Let's fill up here first. I definitely want you in the shot. Sure. I mean, let's see what we end up with, and we'll just go with that. Pick a spot.
Yeah, you don't want
Just pick a piece of tape.
Mary. Thanks so much for joining us.
Hey, Representative, come on down one.
Do you want electeds all together, or do you want to make people?
Let's have the electeds in the middle, right behind
here?
the podium, and then
Okay.
everybody else.
Okay, great.
I don't know who's except for John.
Hey, well, yeah, that's legal, right? That's 6 feet. Great. Yeah, Eric, y'all come on, you come on down, and Laura and
We maybe put like 3 or 4 on that side, keep it for.
sure.
Yeah.
For the camera side, yeah, John, come down.
John, you want to come down
And
here?
Representative-elect Porto, if you'll come on down. Erica, come on over on this side.
Balance on that side of the podium.
Jake, you want me here?
Yeah.
All right, great. How are you doing? All good.
Thank you.
Yes, ma'am. Hey, good to see you. Good to see you. Just right here is great. Just give you close enough to grab the mic.
Long distance.
How's it going? And our future senator?
Yeah, I like the way you talk.
Eric, what ended up happening instead?
They did this race. So it was only a hearing for this race. That's all it was. They went on for 3.5 hours.
And then did he move from the bench?
He told them that they need to go ahead and start discovery, but he didn't want to do it. So did he? Yes, but not officially. So he basically tried to scare the county by saying,
Test that mic.
is this, if the county loses,
Testing. Is it on?
This one right here.
This one?
Basically, yeah.
Does it need to get up closer?
He's like, these can be very expensive and taxpayers are going to have to foot the bill if they lose this.
Thank
The
you.
problem is the
You
argument
want to do it, or you want to hold it?
Yeah, I think that's good.
never took into
Give it
account
a, give it a,
changes.
give it a hop.
Testing?
She never said
Hello?
that, 'cause they were saying, we had a certificate of
Testing?
occupancy.
Is it
And
on?
it was like, yeah, but the science changed,
Testing?
data changed, so now you have to have it. Because this,
What?
she never made that argument.
Well, it's not even the science, it's the use
Hey,
of
hey,
ETO,
hey.
which is the explosives.
Well, they said they've always had
Good,
that.
good, good.
And they showed in their other applications, they've always said they use ETO.
Check. Hey, hey. All right, check. That'll work for us.
Great.
Or not knowing what ETO is.
How you doing? All right.
Yeah, they were just like, oh, okay.
And actually, can I have that? Great. All right. Good morning. Thank you, everyone, for joining us. I'm. We're starting. We'll start over again. Good morning. Thank you so much for joining us. I'm Liz Ernst. I'm a state director at Protect Our Care, Georgia. And it's fitting, today is an overcast and drizzly day, so we appreciate you coming out. Georgians face an uncertain future ahead of us during the worst public health crisis and economic crisis in a century.
Hold on 1 second. Let me see what I can do.
I think you're gonna have to speak directly into it.
You're gonna
Oh,
have
do
get
I
up-
have to?
You gotta get up in it a little bit more.
Maybe like this. I don't want to get too close to it though.
Understood.
Does that work? Is that better?
You gotta speak right down into it.
You got to go into it.
It doesn't even sound on.
Yeah.
It doesn't sound on. Hello? Testing?
Yeah.
Okay.
Gotta be
Yeah, you're gonna have to get close.
All right. Get close. Actually, let's do this. All right. Take 2. Good morning, everyone. I'm Liz Ernst, State Director for Protect Our Care Georgia, and appreciate everyone being here today on this drizzly November day. It's fitting as Georgians face an uncertain health care future during the worst public health and economic crisis of the century. Right now, Attorney General Chris Carr is a part of the lawsuit that is being argued in the Supreme Court to eliminate the Affordable Care Act. So we are here now to remind Georgians what's at stake if the court sides with Trump and the Georgia Republicans and overturns the Affordable Care Act. And simply put, if that happens, the entire American healthcare system will be thrown into chaos, and every Georgian's health and economic security will be at risk. Not only will roughly 4.4 million Georgians living with pre-existing conditions no longer be protected from the whims of insurance companies, but every Georgian's coverage, whether you receive your insurance through your employer or an individual plan on the federal exchange or Medicaid or Medicare, you will be at risk of potential loss or reductions in coverage or see increased premiums. Gone will be the preventative services like flu shots, or when the COVID vaccine becomes available, a free vaccine. And billions of federal dollars directed towards Georgia's public health initiatives and hospitals and the uninsured will cede. Before we start with our speakers, I'd like to acknowledge the elected officials and healthcare advocates and supporters standing up for Georgians' healthcare behind us. Elected officials include State Senators Jen Jordan and State Representative Eric Allen, Mary Robichaud, and Representative-elect Rebecca Mitchell. And we have a number of healthcare organizations, advocacy organizations joining us, including Planned Parenthood Southeast, Healthcare RX and REACH, and the New Georgia Project. So thank you guys so much for standing up for our healthcare. First, I'd like to introduce Laura Colbert, the Executive Director for Georgians for a Healthy Future. Laura?
See if I can do this with the wind and whatnot. Good morning, everyone. I'm Laura Colbert. I'm the Executive Director at Georgians for a Healthy Future. We are a nonprofit, nonpartisan consumer health advocacy and policy organization. I want to emphasize the nonpartisan part of our mission and our vision. As an organization, we measure our progress towards our goals by looking at the health outcomes and the quality of life that are experienced by Georgians and their families. We track how many and which Georgians can easily and affordably see a healthcare provider or get health services when they need to. We examine who is consistently left out of our health system and figure out how to open the door for them through public policy. We do not measure our success by who gets elected to office or by which political party benefits from one public policy issue or another. We exist solely to promote the health and well-being of Georgians through evidence-based public policy. And we are here to defend the Affordable Care Act today. Like everyone else in the last 9 months, Georgians for a Healthy Future's focus has been on protecting the health and wellness of Georgians in the midst of COVID-19. Affordable access to care through quality, comprehensive health insurance has been fundamental to those efforts. Through job loss, through loss of social connectedness, job changes, changes in schooling, and many other life changes that Georgians are going through, the Affordable Care Act has been a steady and reassuring force for Georgians and their families. Georgians deserve certainty and stability in their health coverage and their health care. When health insurance is more valuable than ever for the peace of mind and protections that it provides, Georgia's participation in this lawsuit puts us on very shaky ground. Since its passage more than 10 years ago, the Affordable Care Act has become as much a part of the Georgia health system as the 50-year-old Medicaid and Medicare programs have. More than 480,000 Georgians have enrolled in health coverage through the ACA marketplace in 2020. 9 out of 10 of them benefit from financial help to reduce their costs. Seniors pay less for their prescriptions than they did before the law was passed, and insurers are held accountable for their profits compared to what they actually pay for health services under the law. Every Georgian, whether they know it or not, benefits from the standards and protections that have been put in place by the Affordable Care Act. If the Supreme Court were to strike down the ACA, the consequences would be felt personally and deeply by Georgia households across the state. On Friday, I got a call from a middle Georgia father whose son has coverage through the Affordable Care Act. His son not only buys his plan through the ACA marketplace, but also gets financial assistance. His father gushed about how his young adult son has become successful and independent because of the support of the law and what it has allowed him to do. And he worried about how his son would navigate the new proposed system under the governor's new waiver plan without the ACA's full support. The collapse of the Affordable Care Act, if the lawsuit leads to that, would be disproportionately felt by Georgians of color and rural Georgians. These Georgians are already shouldering the heaviest burdens of the pandemic and face unfair barriers to care even before the pandemic began. This case and Georgia's participation in it only serve to further destabilize these communities that have already been knocked off balance. What Georgians need now is predictability, fairness, and a clear-eyed focus on their health and well-being. This lawsuit undermines those goals, and Georgians deserve better. I am going to pass the microphone, but I do want to remind Georgia consumers that the proceedings today do not impact the current open enrollment period or their current health plans. Folks should absolutely take advantage of the marketplace before the December 15th deadline and get covered for 2021. Thank you. Liz?
Thanks, Joe. And thank you, Laura. Really appreciate those comments, and be sure to enroll in your program by December 15th. So now I'm going to introduce Erica Meyer. Erica Meyer is a Metro Atlanta resident with a pre-existing condition, and is also a healthcare professional who has been working on infectious disease control for the CDC and the WHO. Erica?
Thank you so much for the opportunity to speak today. As Liz said, my name is Erica Meyer, and I'm 31 years old. I was diagnosed with Crohn's disease, an autoimmune disorder, when I was 8. I have been very lucky to have it under control for the last 23 years, but not without regular access to specialists, medication, and procedures. The Affordable Care Act was enacted when I was a senior in college, and I remember being so relieved that no matter my employment status, graduating into an economy that was still recovering from the recession, I could still have access to my parents' health insurance for 4 more years until I turned 26. In part because of my belief that healthcare is a human right, I felt professionally called into the field of public health. I work in infectious disease epidemiology at Emory and have done consulting work for the World Health Organization and other public health agencies. The combination of my personal and professional experiences mean that I take public health and access to healthcare very seriously. I am so disheartened by the loss of trust and faith in the CDC, once the world's foremost public health agency, which was well respected by the American people and governments around the world. The last 9 months of the pandemic have left us in an untenable state. We have a presidential administration that doesn't understand the power of a cohesive national strategy, thinks we have to choose between protecting the economy or protecting our health, and has left it up to state and local governments to put together a piecemeal response. Just like we trust mechanics with our cars and plumbers with our toilets, we need to trust scientists and researchers when they say that testing, masking, and limiting crowds are how we will get this pandemic under control. People are anxious and sick and stressed and dying. And when does the Trump administration choose to continue with this lawsuit? During a pandemic in which the collapse of our healthcare system would be disastrous for millions of people. I'm disappointed and frankly furious that the Trump administration, Senator Perdue and Senator Loeffler are wasting time, money, and political energy pursuing this inhumane and cold-hearted lawsuit. It spells devastation for millions of Georgians who rely on the ACA and would unleash chaos within our healthcare system at a time when we desperately need stability and support. Our senators are supposed to work for Georgians, but instead they're working for Trump and the Republican agenda. They keep telling us that they will protect pre-existing condition coverage if the ACA is overturned. We know they don't have a plan to do that, because if they actually did, they would have implemented it by now. That alone will impact 4.4 million Georgians, including me. We need John Ossoff and Repeal Warnock in the Senate, who will take the crisis seriously and who will protect our care. From my professional perspective, electing John and Repeal to the Senate is critical to getting the pandemic under control. They will help focus a national strategy to ensure that the federal, state, and local responses are well coordinated and well funded. Tackling this crisis at the federal level across the country and distributing a safe and effective COVID-19 vaccine is how we will open our schools, open our economy, open our borders, and how we learn to live with this virus. Thank you very much.
Thanks so much, Erica. Really appreciate your comments. And now I'd like to introduce Janelle Green, who is a DeKalb County resident who is currently undergoing treatment for breast cancer, her second bout, unfortunately, and she is a affordable housing director for Cathedral Towers. Janelle?
Thank you. Good morning, Georgia. My name is Janelle Green, and I'm a mom from Decatur. Last time I saw most of you, I proudly called myself a breast cancer survivor. But recently, I learned that the cancer has come back. And now I face a lifetime of treatment to keep it at bay, praying for a cure. I'm happy to be here with all of you, surrounded by leaders who value our health care as a human right and work tirelessly to preserve the protections that we all have under the Affordable Care Act. So thank you all personally. It is truly astonishing that in the middle of this pandemic, Senators Loeffler and Perdue would support our government going to court to try to take health care and the health care protections provided by the ACA away from every American. And this happens to every American. It doesn't matter if you're in a marketplace plan or if you're in a private plan, the ACA protects us all. And that's exactly what they're doing. While millions of Americans like me benefit from having protection from discrimination due to having a pre-existing condition, and because insurers can no longer charge me more simply because I'm a woman, we all benefit so much more. My annual visit to the doctor costs me nothing because the ACA ensures that we get free preventive health care. I don't have to worry about my insurer dropping me because I'm sick, thanks to the ACA. Just one of the medications that I take every month costs over $10,000 a month. Because of the ACA, I don't have to worry that my insurance company will set limits on what they will pay for my care in any given year or in my lifetime. My health insurer must provide coverage for cancer because of the ACA. Before the ACA, the insurance market was full of junk insurance plans that covered almost nothing. And that is exactly the kind of junk insurance that our governor, Brian Kemp, is trying to give Georgians. Yes, I am in a fight for my life, but Georgia, so are all of us. Just last week, record numbers of Georgians stood up and voted for President-elect Biden, who has vowed to protect and build the ACA to help even more Georgians. We must stand up and fight back against the heartless attacks on our health care and on our very lives. The last thing any person needs to worry about in the middle of this pandemic is whether or not they have health care and can afford to go to the doctor, especially not the most vulnerable among us. So when you go to the polls on January 5th to elect Georgia's 2 senators, are you going to choose Senators Perdue and Loeffler, who profited from the pandemic and are actively trying to take away health care and our health care protections? Or are you going to vote for John Ossoff and Repeal Warnock, who are 100% committed to protecting us all and ensuring the protections of the ACA will be here for me, for my son, and for all Georgians? The choice is easy. Remember the ACA and our health care at the polls. Register to vote. Make your voting plan. Tell everyone you know that health care is on the ballot in January. Now go vote for our lives. Thank you.
Thank you so much, Janelle. Really appreciate your comments and for being here today and all that you're doing for yourself and your family and for all Georgians. Next, we'd like to welcome Congresswoman-elect Carolyn Bourdeaux. Welcome. Thank you so much for being here. She will represent Georgia's 7th Congressional District in January, and she was inspired to run based off of her family struggles and her struggles within the healthcare system, and we're very honored to have you represent us. Thank you.
All right. I'm a little shorter than Janelle, so. Well, thank you guys for putting this together. Can you hear me okay? All right. And I thought it was very important to come down and do this because healthcare really was one of the driving issues in the race for Georgia's 7th district. It is an issue that is very, very personal to me. My father suffered from a prolonged illness for about 10 years. My mother took care of him, and all of their discretionary income was eaten up paying for his prescription medications. But beyond that, I have heard story after story after story of people who really suffer with the healthcare system as it currently exists. We don't need to be going backwards in this fight. There are 120,000 people in the 7th Congressional District without health insurance. Middle-class families pay very, very high rates for health insurance. And of course, we didn't expand Medicaid. When I first got into this race, some doctors came to me and told me a story about a man who had come to them in desperation. He didn't have health insurance. He was low income, so was not covered in Georgia because we have not expanded Medicaid. He was curled up in excruciating pain because he had advanced stage rheumatoid arthritis. And he worked as a day laborer, lifting boxes in a warehouse for a living. And of course that meant he didn't have employer-based health insurance. And he'd waited though until he could no longer work, until he was crippled by the disease, to come to see the doctors. And they had to tell him, we're so sorry, if you'd come to see us a few years earlier, we could have given you anti-inflammatory drugs that would have protected your joints, and you would still be working today. But now the disease has destroyed your joints, and there's really nothing we can do but give you painkillers to relieve your suffering. And the irony of this is now this man is eligible for disability, and now he's eligible for Medicaid. It is morally wrong that we hang our people out to dry this way. It is also fiscally irresponsible because each and every one of us pays for the uncompensated care. Of course, we pay for disability in our own rising health insurance premiums and in our rising taxes. The Affordable Care Act is incredibly important to the people of the 7th District. And not only do you have these issues where you have uncompensated care, but our business community is very, very dependent on this legislation. We have a host of entrepreneurs, of small businesses, of people who are self-employed. And in the 7th District, we have some of the highest enrollment on the health insurance exchange in the state of Georgia and in the country. It is absolutely staggering to me that in the height of a pandemic, we would have a president, as well as obviously the Republican leadership here in Georgia, my opponent in this race, our current senators out there supporting litigation to bring down the Affordable Care Act in its entirety. And that means the coverage for people with pre-existing conditions. All of those protections would fall. The protections for young people who are able to be on their parents' health insurance would fall. And there is no plan B. There is nothing out there. And it doesn't matter how much David Perdue and Kelly Loeffler go out there and say they want that covered. It is not. And what they are doing is enormously destructive. I am planning to go to Washington and be a strong advocate to ensure that health care is treated as a human right and that every man, woman, and child in my district, as well as the state of Georgia, has access to quality, affordable health care. And I strongly encourage everyone to vote for John Ossoff and Reverend Warnock because they share that commitment and that passion. Thank you for having me.
Thank you so much, Congresswoman-elect Bordeaux. And last we have investigative journalist and small business owner John Ossoff, who supports increasing protections for pre-existing conditions and the Affordable Care Act and strengthening it. So thank you so much, John, for being here.
Good morning. Thank you for being here. I want to take a moment and just thank and congratulate once again United States Representative-elect Carolyn Bordeaux of Georgia's 7th Congressional District for her tenacity and persistence, and Representative-elect for your victory. And Georgia and our country will be better off having Carolyn Bordeaux looking out for us in the U.S. House of Representatives. We're here this morning because today the Supreme Court begins to hear oral arguments in this attack on the Affordable Care Act, which is supported by Georgia's Attorney General and by both of our United States Senators, David Perdue and Kelly Loeffler. Senator Perdue and Senator Loeffler support this lawsuit because they want their donors in the health insurance industry to be able to make as much money as possible with no obligation to the public interest, with no obligation to public health, and with no responsibility to provide coverage to people when we need it most in our lives. Janelle, thank you for sharing your personal story with us. It is a travesty that our representatives in the United States Senate want to allow insurance companies to deny health coverage to people who are fighting cancer, to people who are struggling with pre-existing conditions, to children who have asthma, to Georgians with high blood pressure or diabetes. You know, I had the opportunity to debate Senator Perdue in Savannah a couple of weeks ago. And I asked Senator Perdue why he had voted 4 times to repeal protections for pre-existing conditions. And I asked Senator Perdue why he was still supporting this effort to destroy the Affordable Care Act in the middle of a pandemic. And Senator Perdue had no answers. Because Senator Perdue can't be honest with us about what motivates him. He's looking out for the insurance industry and its profits, and he's putting their interests ahead of the health of Georgia families. We're in the middle of a global health emergency, unprecedented in our lifetimes. This is a moment when all of us should be uniting to expand access to affordable health care, to make sure that nobody loses their coverage because they get sick, to make sure that everybody can afford their prescriptions. This is not a matter of partisan politics. This is a matter of the public interest. And over these next 8 weeks during this runoff election, I will continue to demand that Senator Perdue explain his indefensible support for these efforts to destroy access to health care for his own constituents in the middle of a pandemic. So thank you all for being here. I'll turn it back over to our host. Thank you, Protect Our Care, and thank you to all the elected officials and supporters who are here today.
Thank you so much, John. Really appreciate it, and for standing up to protect our care. So now we'd like to open it up for questions to our speakers. If anyone has any, take them one at a time. We've got one here.
Yes, thank you. My name is James Davenport. I am the president and founder of the Hickory Health Foundation. I have pre-existing conditions. I have been diagnosed with brain aneurysm, chronic kidney disease, stage 3, enlarged liver, high blood pressure, torn rotator cuff for the 3rd time. My concern is simply this: it is a little bit different. MARTA eliminated 71 bus schools in the midst of this pandemic.
Do you have a question?
Yes, my question is, will you, all of you standing there, assist me in getting MARTA to reinstate these bus schools? People are hurting. The governor said he wanted to open up the economy so people can get back to work. However, these people cannot get to
I'm
work.
sure you can have that conversation with people afterwards,
Yes,
but we're
ma'am.
focused on the ACA and healthcare, so
Thank
thank you. Does anyone? Yes.
Hi, a question for Mr. Ossoff. With a Biden administration coming in, how does that change, do you think, what happens with the ACA, no matter what the Supreme Court does? And what do the 2 Senate seats mean to the ACA if control of the Senate is over?
Yeah, this is why these Senate runoffs are so vital. Because if the Supreme Court strikes down the Affordable Care Act, then it will be up to Congress to decide how to legislate such that pre-existing conditions remain covered. And if Mitch McConnell and David Perdue and Kelly Loeffler are determining the course of policy, then they will allow the Supreme Court's ruling to stand and to undermine those protections for pre-existing conditions. So if we do not win these Senate races, and if the Supreme Court strikes down the Affordable Care Act, then Georgia families and Georgians with asthma, diabetes, high blood pressure, and cancer will be at risk of having their health coverage denied by insurance companies. Thank you for the question.
Next question.
Here's a follow-up on that one for Mr. Ossoff. I mean, what kind of fixes would you pursue in the Senate that you think would actually be an effective fix if the Supreme Court were to overturn the law?
Well, first of all, if the Supreme Court overturns the Affordable Care Act, then it will be pursuing a partisan, ideological agenda instead of impartially upholding the rule of law and the public interest. But if that is how the Supreme Court proceeds, then it will depend upon the basis of their ruling what legislative steps Congress needs to take to ensure that those protections for pre-existing conditions are reinstated. My commitment is that in the U.S. Senate, I will work with colleagues like Congresswoman-elect Carolyn Bourdeaux to ensure that swiftly we not only reinstate those protections for pre-existing conditions, but we strengthen them and we crack down on price gouging for prescriptions by drug companies, and we ensure that we are expanding access to health care for Georgians instead of destroying it. Thank you.
What would you do to strengthen the pre-existing conditions?
Say that again, Greg.
What specifically would you do to strengthen the pre-existing conditions?
Well, right now there are still inadequacies, and we still have Georgians who risk loss of insurance or denial of coverage. And what Congress should be doing right now is strengthening the Affordable Care Act, rather than our elected officials supporting litigation that would destroy the Affordable Care Act and leave Georgians at the whims of the insurance industry who don't want to be encumbered by these protections because they undermine some of their profitability.
John, this is off topic, but do you have any comment on Senator Leffler and Senator Perdue yesterday calling for Secretary of State Raffensperger to resign? Do you have any comments on them? Seeming to undermine the election.
One more time?
Do you have any comment on Senator Perdue and Senator Leffler yesterday calling for Secretary of State Raffensperger to resign? Do you have any comment on Republican efforts to challenge the election results?
Not at this time. I'm going to stay focused on the Affordable Care Act and health care. Yeah.
We're going to ask one more question of
Okay.
John.
One more. Yeah. Yes.
My name is Robert Wolford, John, from Dunwoody, Georgia, and I'm an independent voter. But I'm very curious to know, when you become our next senator after this runoff, what can you do to help convince Republicans and others that seem to vote against their own interests when it comes to the Affordable Care Act? How can you include them in this conversation in such a way that they understand when they vote for somebody like Senator Loeffler or Senator Perdue, they're actually voting against their own interests?
Look, our family's health should not be a matter of partisanship. And I think that one of the reasons that you see public servants like those who are assembled here so focused on this issue is that it rises above petty daily politics. This is about human lives. When my wife treats patients at the hospital, she sees every day how many Georgians are suffering, at risk of death, in financial distress, because our state has refused to expand Medicaid. Because there is still so much work to be done to strengthen the Affordable Care Act and make sure that every family in the state can afford care. So it is vital that we remain focused on the human consequences of these policy decisions, not the daily punditry, but the fact that people's lives are at stake. And we are still in the midst of a grave public health crisis. Hundreds of thousands of lives hang in the balance. And for our senators to be attacking and undermining health care for their own constituents in the midst of it is unforgivable. Thank you. And I'm going to...
Thank you. Thank you so much, John. If anyone has any other questions for any of our speakers, you may ask that now. Are there any other questions? Yes.
Again, Robert Wolford from Dunwoody, Georgia. Although I'm in the 6th district, congratulations on your victory in the 7th, is it? Yes. Same question basically that I just asked John. How, because it's such a tight district politically, how are you going to reach out in your district with people there that concerning the ACA and how it affects them in their lives, and get them to understand that, again, often they're voting against their own interests when they vote for the candidate as your opponent, not for you.
Sure. The question is, how do you bring people together around the issue of health care and making sure that everyone has quality, affordable health care, given that we are so divided right now as a nation? And what I have done in the past, I have worked on very tough issues before, like the budget during the Great Recession. And what we need to do is to go and have really that one-on-one dialogue. As John was saying, this is a very intensely personal issue for all of us. Many of us are one lost job, one healthcare crisis away from medical bankruptcy. And pointing that out and having that conversation, it is one of the central issues for the small business community in my district. Many of them are very, very dependent on getting their own health insurance through the exchange. Many of them have pre-existing conditions, and so are deeply concerned that they could lose their health care coverage or be priced out of the marketplace. And so there is a lot of room to continue to have that dialogue with people, and that I care about them, I care about their struggles, and it does not have to be this way.
Thank you.
Thank you so much. So this concludes our press conference. We do have some concerned Georgians with pre-existing conditions and who are affected by this decision available if anyone would like to talk with us afterwards. Again, thank you so much for joining us today, and have a good day. You guys want?